Don't give your patients a Joker smile when trying to correct a downturned mouth. This type of result can look bizarre, which we'll get to later in this video. But many of you will be thinking, but I can't even lift a downturned mouth anyway. It's actually one of the most challenging areas to treat. And in this video, I'll be covering my strategy, but also I really want you to understand how not to overtreat it. The mark of a good injector is to know how to do things, but also when has it gone too far? There's a missing piece in medical aesthetics training, and this is why overtreatment is so common, and also why disappointing results happen.
Oh my gosh, she's gonna roast me so bad.
What did you do?
And if you'd like to understand this missing piece to take your treatments to the next level, make sure you watch the rest of this video. So what happens if you overlift a downturned mouth? It's a rather strange result where patients look constantly happy, but they're really not. Essentially, they get a slightly disingenuous expression. They look happy, but you can tell that they're not. And this happens when there's a little swish on the corner of the oral commissure. Now, how does this happen? It happens because many patients will come and ask specifically to lift a downturned mouth because it makes them look sad when they're not. Essentially, it's the opposite problem. They feel neutral or happy, but they look sad. This then becomes the focus of the whole consultation. How do I make the patient look happy? You then go digging in your bag of techniques to find something that will lift the corner of the mouth, and you set off trying to lift. The problem with this is it is so focused on just the one area that if you put all of your effort into just one area, it's very hard to get the result without causing a sense of overtreatment or disharmony. So there must be a better way, and there needs to be a better framework so that you can make a decision about when enough is enough, and when there are better ways of getting a more natural result by thinking more broadly than just the downturn itself. So let me share with you how I might have incorrectly approached this patient 15 years ago, had she attended asking me to help her with a downturned mouth. She has a small shadow at the oral commissure that makes her look sad when she's either neutral or happy. And of course, nobody wants that. We want to look how we feel on the inside. What would I have done? I would have gone straight to focusing on the shadow that she came with. I would have looked at it and thought, I need to support this tissue here with some struts of dermal filler so that it pushes up in the other direction. I may have treated her depressor angularis with some toxin, so maybe there's 3 to 4 units here. I may have looked at her lip and thought maybe I can use volume in her lip to support the oral commissure and treated them as well. And what might I have actually achieved at the end of all this effort? The strategy I would have employed would have been so targeted at lifting the oral commissure that I probably would have succeeded. But this lifting in an unnatural way starts to cause a slight upturn with a flick. It's like a Nike swoosh appearance that looks like the Joker smile. The end result is an upward flick on the end of the mouth where it should be tapering down. There's a disconnect. We can see the natural shape of the mouth, and then we see the upward lift that comes afterwards. I've successfully elevated the corner of her mouth without making her any more attractive. What I would do now, if she came to my clinic, is very different. In the last 15 years, I have learned to see all faces as one structure with independent components I can tweak. There's a systematic approach where you look at the shape and the curvature of every part of the face, and you start to see that there is a connection, a structural connection between different parts of the face, which means you can use nearby structures to elevate structures that you once treated only in isolation. Let's see this in real life with this patient. Looking at her mid and lower face together, you can see the lack of support happening here up in the cheeks, and how this is also causing one of her other problems, which is a shadow under her eye. This superficial fat in her cheek is pushing downwards on the area that we're trying to lift. And although it might be subtle, there is a connection here. All of this tissue is the reason why we have a downturned mouth. So if I'm more holistic in my treatment plan, I'm much more likely to generate a natural looking result. And this applies both above and below the downturned mouth. It's actually one of the reasons why you should consider treating the chin. It all boils down to the overall balance of muscle, fat, and tissue in the overall face in the lower third. So if you project a chin outwards, it causes relaxation of the mentalis, which also decreases resting tone of the DAO. We can also support the DAO more generally by restoring the overall contour of the chin. Broken down into steps, I want to see what is the ideal shape of the chin. I know it needs to be better defined. I know this is ideally a straight line, and that tells me more about treating this section here. I know the cheek also needs to be better defined, so I feel confident to add volume and support the upper part of her face, which adds support to the lower third. Her nasolabial fold is also part of a treatment that supports the lower third of her face. Once I've done all of this, I may have then got to the stage of doing what I did first 15 years ago, which is adding small struts of filler just to add a little bit more support. But because I've done so much other work, I don't have to try so hard with this very focused technique. I can add a little bit in her lips and I can add a little bit in the oral commissure directly. But this whole structure is now supported by surrounding replaced volume above, below, lateral and medial, which means I need to try a whole lot less hard. Essentially, by tweaking the face a little bit in lots of different areas, I put less in each individual area to get a more natural overall result. The key takeaway of what we just discussed is to start to see the face as one three-dimensional structure with many points that you can tweak that are all synergistically connected. A holistic treatment plan may use overall more filler, but it will use less in each individual point and create more natural looking results. It's the problem focused rather than the aesthetic focused clinician that causes overtreatment. We're all trying our best, but we don't have the right strategy or holistic understanding, and we don't know how to bring our patients onto the journey to see the problem in the same way. We need a framework that teaches us not just about the proportion or the techniques used, but about the actual shape and detail of different elements of the face and how it all works as a whole. The individual components, the most projected points, how those points are connected together, and the planes that make up the surface of a human head. When the injector understands the desired three-dimensional shape of each part of the face, you can start to assess in much more detail. Do we need to add more volume or less volume? Do you want to make a particular point project more outwards, or do you want to blend it in so that it's less dominant in the face? The missing piece in medical aesthetics training is the ability to diagnose the aesthetic potential. This is the gap between where a patient is and where they could be, because if you can diagnose that gap, not only is it useful the first time you see your patient, but it's useful in managing them over a lifetime. It gets harder the longer you see patients. You cannot rely just on the common patterns of aging. You need a framework to assess each point systematically to keep everything in balance. Over the last 4 years, I've looked in depth at the structure and shape of the human form in 3 dimensions from an artistic-only perspective. And I'm applying this to medical aesthetics. If you would like to learn my framework, click the link in my description for more information.